And sadly, right now in British Columbia, there are people who just simply don't have access to healthcare when they need it. To not have a maternity ward or obstetrics, the Cloverdale Hospital does not have an ICU for pediatrics. This is completely out of step with the needs of the community. David Eby burnt through that surplus. I think it was something like $5 billion, $5 or $7 billion of surplus. David Eby shoveled that out the door like it was on fire.
ਚੈਨਲ ਪੰਜਾਬੀ ਦੇਖ ਰਹੇ ਦਰਸ਼ਕਾਂ ਦਾ ਪ੍ਰੋਗਰਾਮ ਫਰੰਟਲਾਈਨ ਵਿੱਚ ਬਹੁਤ ਬਹੁਤ ਸਵਾਗਤ। ਦੋਸਤੋ, ਅਸੀਂ ਪਿਛਲੇ ਦਿਨਾਂ ਤੋਂ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਹਾਂ ਇਲੈਕਸ਼ਨ ਸੰਬੰਧੀ ਵੱਖ-ਵੱਖ ਉਮੀਦਵਾਰਾਂ ਦੇ ਨਾਲ। ਅੱਜ BC ਕੰਜ਼ਰਵ ਤੋਂ ਐਲਨੋਰ ਸਟਰਕੋ ਸਾਡੇ ਨਾਲ ਨੇ। ਸਰੀ ਕਲੋਵਰਡੇਲ ਤੋਂ ਇਸ ਵੇਲੇ ਉਹ ਇਲੈਕਸ਼ਨ ਲੜ ਰਹੇ ਨੇ, ਉਹਨਾਂ ਦੇ ਨਾਲ ਆਪਾਂ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ। Welcome to the show and thank you for joining us.
Well, thank you for having me.
How's going the campaign?
It's going great. Campaigns are an exciting but tiring time. Door knocking and campaigning really started long before the writ dropped. So I've been literally on thousands of doorsteps talking with people in Surrey Cloverdale, and I'm looking forward to Election Day, which is this weekend.
And what are the common man's issues they are talking about you when you are going door to door?
I think the most prevalent concern that people have is with our healthcare system. After that, we hear a lot, depending on the house. Like if it's a house with young kids, you're going to hear a lot about our education system. We also hear from people about affordability, housing, crime, a variety of issues. But I would say that one of the primary concerns we're hearing on the doorstep is with our healthcare system.
So when we talk about the healthcare system, NDPs, they are blaming the poor performance of the Liberal Party, and they said that John Rustard, your leader, he was a part of that cabinet at that time, and they sold the hospital's land at Highway 10 and 152. So what do you want to say on this?
It's funny because the NDP often likes to speak right now about past governments. They point the finger of blame at everyone. They refuse to look in the mirror and recognize the fact that they have been in power for the past 7 years. And they have decided on a project in Cloverdale, for example, with the new Cloverdale Hospital, to start a hospital that really is not aligned with the needs of the community. So, for example, Surrey is one of the fastest growing communities in British Columbia. We have one of the largest youth populations. And literally thousands of babies are being born in Surrey. In fact, 1,000 babies over the capacity of Surrey Memorial Hospital. And mothers are often placed on diversion. Yeah. And, so to not have a maternity ward or obstetrics, the Cloverdale Hospital does not have an ICU for pediatrics. This is completely out of step with the needs of the community. So I'm really proud. Conservatives of BC have committed, if we're elected, we're going to build a Women and Children's Centre of Excellence, a new hospital for women and children in BC, right in Surrey. I'm very, happy to see that a hospital is going up in our community in Cloverdale, but what's disappointing is to see it's only 168 beds, to see that, if you have a critical illness, if you're having a heart attack, you will be sent away, you'll be diverted from that hospital because it doesn't have what you need, no cardiac services, no stroke clinic. So, like many things, the NDP are completely out of step on this. And I think, it speaks volumes to just how out of touch they've been with Surrey and how neglected Surrey's been over the last 7 years. It's no wonder to me that they want to point fingers and divert away from their own, mistakes over the last 7 years. But the reality is, if you look at where we were 7 years ago and where we are today, they have failed by every metric, by every measure of providing healthcare for British Columbians.
And do Conservatives prefer for the privatization of the system, and don't you think that will create a two-tier system and only the rich will get the services?
Well, this is the thing, is that Conservatives are not creating a private system for pay. This is, an NDP lie. They want to scare people into thinking that Conservatives would be doing something that would harm healthcare, and it's absolutely not true. They're incorrect. We will be investing in healthcare, not making cuts to healthcare as they lie about. The reality is that they have left this system in such shambles that there are people literally dying on wait lists. There are people who have to now be sent to the United States because they cannot receive the care that they should be having here in British Columbia. Our platform, what we will bring for British Columbians, is actually an expansion of services that already exist here. So for example, maybe people don't know that a family doctor is a private business. And what happens is that you go visit your family doctor and they submit a bill to the government to get paid for your visit. And so this is what we're actually talking about expanding, isn't making it so that you have to pay. This is still single payer, universal health care, where all you need is your health card. But we'll expand the available services that are allowed to be provided outside of the government. So meaning maybe we'll do an expansion of MRI clinics. Maybe we'll be able to have an expansion of some surgery clinics so that we relieve waitlists at hospitals and allow for more choice for people to go to. But again, all they're going to need is their health card number. If anything, it's the NDP that's created this two-tiered system, because there's people right now waiting and waiting even to hear from BC Cancer for the cancer that they've recently been diagnosed with. They won't hear for months what's going to happen. But if you have money, people already go out of country. People already pave their way to go even to the States or Mexico to try to receive treatment that they can't get here in BC. We strongly value, as a Conservative Party, universal health care, because we know British Columbians value universal health care, that single payer, that the government shall pay using our tax dollars. But we don't have universal health care if you can't get it. And sadly, right now in British Columbia, there are people who just simply don't have access to health care when they need it. We have people waiting oftentimes in the emergency room because they know that it's faster to wait 12 or 13 hours to get a test done at the emergency room than wait 18 months to get it if they don't go there. This is also adding to some of the congestion we see in our emergency rooms. And it was just, people probably remember a couple of weeks ago, doctors from Surrey Memorial Hospital came forward with a letter. We're receiving substandard care in Surrey. And it's not like the NDP's only been in power like a couple days. 7 years, that's almost a decade. So, it really rings hollow. It's desperation.
They're saying there were two years for the COVID and...
they love to bang the COVID drum, but I'll tell you that, when COVID ended, John Horgan had left a surplus for David Eby, and then he retired. David Eby burnt through that surplus. I think it was something like $5 billion, $5 or $7 billion of surplus. David Eby shoveled that out the door like it was on fire with nothing to show for it. Not only that, but now we're how many billion dollars in the deficit? At least $9 billion in deficit, and growing considering all the promises that he's made. And just to keep the lights on in the province, it's costing taxpayers $9 billion more than what we're bringing in right now. And his only solution is to dig into your pocket for tax dollars. And that is not a sustainable model for now, and not one that will last us into the future. The bills and the debt that David Eby is accumulating, if you don't pay it today, it's for your grandchildren and great-grandchildren to pay. We want to make sure that we're still providing the services that we need. We want to be able to provide, and we will provide, healthcare services under a single payer, which is still funded by the government. But we want to have more economic growth. We want to be able to invest and really remove the barriers and the red tape from resource development, from working even with new energy sources, looking to expand everything from wind and solar and all types of energy sources to help power things like mines, and other resource development, because it's time for us to stop digging this big debt hole, that it will have to get paid. We've already had 2 credit downgrades under David Eby, and we need to get this province back on track. And the reality is that they can use all the fear tactics they want, all the scaremongering that they want, but you only have to look around and ask yourself, are you better off today than you were 7 years ago?
And how will you manage the finances? How will you balance the budget? Because when Conservatives, they are talking about the new hospital and everything, and the family doctors, that is a big problem, then what will be the source of income basically?
Yeah, I mean, it's a challenge, particularly knowing that the extent of the deficit that David Eby has driven this province into. And we actually believe we're probably a lot worse off than they're admitting. So once we get in and have a look at the books, I'm sure it's been an absolute smoke show in there of debt and deficit. One of the things is curbing inflated government spending. So there's a lot of excess bureaucracy. When you look at the level of even bureaucracy within our healthcare system, we need to try to streamline processes so that our resources that we do have, the dollars that we do have, that are public dollars, need to be streamlined into frontline resources. Again, John's been very clear. We don't actually think we can get this budget balanced and remove the deficit in 4 years, because that would hurt people. And that is not our plan. Our plan is to get back on track, but still be able to, invest in healthcare and do the spending that we need to do. Because of the mess that David Eby and his government and his absolute lack of financial responsibility, it's going to take quite some time to clean up. And we will do it as a gradual process, coming from looking at bloated government spending in terms of bureaucracy, removing some of the red tape and streamlining processes, but also, look, because we're not ashamed of our natural resource sector. We want to open mines. We want to be able to, stimulate growth and to support businesses. We're a free enterprise party. We want to be able to support businesses, big and small, through tax cuts and incentives, so that actually the money that we generate in this province comes from economic development and job creation and stimulus, instead of, every time you turn around, David Eby and his crew are picking your pocket.
Let's talk about the parties. You were with the BC Liberal or BC United, and then you are contesting from the BC Conservatives. So sometimes people think they are the same people and the same party. Is there any ideological difference between the BC United and the BC Conservative, or there is something right-wing or far right-wing thing in the BC Conservatives?
We're a free enterprise coalition, really, of people who are on the right of center, and we are a spectrum of people everywhere from center right, more in the center, and to people who are further away from the center. You also see that on the left as well, where you'll have some people closer to center and then some absolutely far left people there as well.
You're right.
But the key to having a successful party is actually being able to bring people together on the things that matter. So, of course, there's many things that differ in personal opinions between many different people, including when I was in BC United. I didn't always agree with every single, opinion of every person in that party either. But it's about finding ways to work together on the things that matter most to British Columbians. And so what I mean by that is, I might not, I don't practice the same religion, for example, as other people in my party. But what we share in terms of our values is that we believe in economic development and paying the bills through a strong economy. Because when you have a strong economy with a strong provincial income, then the sky's the limit to what you can actually provide for British Columbians. And so that's what really has united me with this party, is that we do have a very strong set of beliefs when it comes to how we want this province to move forward, and that is not forever swimming in an NDP debt, but actually generating income on behalf of all British Columbians that we can, use to fund, world-class healthcare system, and to fund schools, and to do the things that British Columbians truly need. We have 6 people a day dying of overdoses. We need to provide treatment, and that's going to cost money. So we have strong partnerships with business, and we want to be able to support business. But are there differences between BC United and Conservatives of BC? Of course. There are differences. I think that Conservatives of BC are much more stronger and more clear in their messaging in terms of, where we stand on the issues. I'm really proud of the way that, we're moving ahead very strongly to let people know, for example, that we want to shift the way that we are dealing with the opioid crisis, away from what seems to be really a one-sided push of harm reduction to a more balanced approach where we are focused on, the understanding people can get better and we want to help them get better. So, I'm like, it's been a really interesting experience for me to cross the floor. I think I've grown as a person because it was challenging. It was really challenging. It's a very personal thing to do. It's a very public thing to do. There's obviously friendships, but I am very much committed in my belief that we just can't afford 4 more years of the NDP and their policies. And so, that really fueled my desire to work with John Rustad and the team. And I have found a home in the Conservatives of BC. And, it's interesting. I think sometimes people think like, because I am more of a centrist, how could I be so comfortable in this party that they may see as being further to the right? And I always tell people, they recruited me and invited me to join together with them and to work with John, not in spite of who I am, but because of who I am. And because we are a party that has lots of different views and we want to include as many people as we can, and to ensure that people understand that there is a home for many different people and different perspectives in the party. But that we are a party that's committed to uniting on the things that are important to British Columbians, like healthcare and the economy.
So you just talked about the 6 people dying every single day with the overdose and opioid crisis is there. There is some news they are saying that there is a wave of conservatives, but there is a criticism that because people are having problems with the system, they are supporting the opposition. So what plan do Conservative Party have for the 6 people dying every single day, and that is pandemic from the 2016 and we are going through? Do they have any solid plan for that?
Yeah, absolutely. I was the critic for mental health and addictions for the last 2 years. And, I'm a retired police officer, so I dealt with, frontline experience with dealing with people suffering from addictions, dealing with overdoses, having to give the terrible news to loved ones that their family members passed away. So, to me, it's really personal to me. So it was important for me also to make sure that, going forward, I was able to contribute as much as possible to the team, that we would have a strong way forward on dealing with the opioid crisis. We want to make British Columbia a recovery community. And that means that, that we set the groundwork and we set an atmosphere that really promotes wellness and helps people get better. We have the understanding, our belief is that people can get better. So yes, we're going to remove financial barriers for treatment, removing financial barriers for counseling, vastly increasing access to treatment. And one of the things that's very important to me is that we're going to do a heck of a lot more than this government ever did. The NDP really failed at prevention. And so we want to have a robust drug prevention program with a direct focus really on speaking to kids and young adults and letting them know the dangers of all drugs. Even prescription drugs can be deadly. One of the biggest failures of David Eby and his government is their so-called safe supply. They should not call drugs safe. There is no safe drug. We need to stop sending the messages to especially young people that using drugs is safe, because it's not. We need to warn people of the danger and protect them from the harms of drug use. We also will do a much stronger effort than the NDP has at tackling the import of chemicals used to make deadly fentanyl. We need to attack this issue from multiple angles. Providing the health services that people need, we will do that. But also fighting against the drug dealers, making it more difficult for them to produce fentanyl here in Canada, street fentanyl, and to traffic it. 6 people a day dying is too many, and even 1 a day is too many. But nobody can deny that it's gotten worse over the last 7 years, and what David Eby and the NDP have done in response to this crisis has only made the problem worse.
Last question, why people of your riding, Surrey Cloverdale, they should think that Eleanor Stricko is the best candidate for them?
You know, over the last 2 years, I was elected in a by-election in 2022. I've served, I would say, very well in the BC legislature. I will fight for British Columbians regardless of, I want to win in Surrey Cloverdale, that's my community, but I also will fight for all British Columbians, because at the end of the day, we're all one. We all deserve health care. We all deserve to have safe and prosperous schools for our kids, to deserve to live in British Columbia and not have 1 in 3 people thinking of leaving. But I'm an experienced person as a former police officer. Public safety is really important to me. I will fight to make BC safer. I'm a parent with kids in the school system. I will continue to advocate and fight for better education and more schools here in our community getting built faster. You know what? I've built a life of public service, Canadian Armed Forces Police, as an MLA in Victoria, and I will continue to serve the public to the best of my ability, and I will fight for the people of Surrey Cloverdale.
Thank you very much. Thank you for sparing your time and joining us.
Thanks for having me.
Thank you. ਦੋਸਤੋ ਅਸੀਂ ਐਲਨਰ ਸਟ੍ਰਿਕੋ ਦੇ ਨਾਲ ਗੱਲਬਾਤ ਕੀਤੀ। ਸਰੀ ਕਲੋਵਰਡੇਲ ਤੋਂ BC ਕੰਜ਼ਰਵੇਟਿਵ ਵੱਲੋਂ ਇਸ ਵੇਲੇ ਚੋਣ ਲੜ ਰਹੇ ਨੇ। ਪਹਿਲਾਂ RCMP ਦੇ ਵਿੱਚ ਲੰਬਾ ਸਮਾਂ ਰਹੇ ਨੇ, ਮੀਡੀਆ ਦੇ ਵਿੱਚ ਰਹੇ ਨੇ। ਸੋ 19 ਤਰੀਕ ਨੂੰ ਇਲੈਕਸ਼ਨ ਆ, ਆਪਣੀ 19 ਤਰੀਕ ਨੂੰ ਵੋਟ ਤੁਸੀਂ ਜ਼ਰੂਰ ਪਾਓ। ਵੋਟ ਦਾ ਹੱਕ ਬਹੁਤ ਔਖਾ ਮਿਲਿਆ, ਇਹਦਾ ਇਸਤੇਮਾਲ ਜ਼ਰੂਰ।
ਸਾਡਾ ਹਰ ਇੱਕ ਪ੍ਰੋਗਰਾਮ ਦੇਖਣ ਤੇ ਸਾਡੇ ਨਾਲ ਜੁੜਨ ਲਈ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ ਚੈਨਲ ਪੰਜਾਬੀ ਤੇ ਨੋਟੀਫਿਕੇਸ਼ਨ ਲਈ ਬੈਲ ਆਈਕਨ ਵਾਲੇ ਬਟਨ ਤੇ ਕਲਿੱਕ ਕਰੋ।